For those of you that are watching this presentation, Dr. Ryder feels that your tongue might be part of your orthodontic problem. The tongue is a powerful muscle that can change the position of your teeth and your jaw bones. I'm going to make this real easy for you. There are 7 exercises to help correct your tongue habit. The first of the 7 exercises is simply understanding where your tongue should be at the right time. Now, the rest position of the tongue is on the roof of your mouth. And if this is your teeth, the tongue should not be touching your teeth. The first exercise is finding the rest position of your tongue. The rest position of your tongue is supposed to be on the roof of your mouth. If you will take your tongue and feel the roof of your mouth, you'll feel those bumpy ridges. And the tongue, the rest position, should be elevated and behind those bumps. And the exercise that you're supposed to do is just simply closing your lips, breathe through your nose, and make sure that your tongue is elevated behind those bumps on the roof of your mouth. The second exercise is recognizing where your tongue is and what it is doing. For instance, when some people talk, they thrust their tongue against their teeth, or when they swallow, the tongue hits the teeth, and this is not good. So you have to become aware of this if you want to change it. So what you do is you say to yourself, my tongue should not be pushing against my teeth. So you touch your teeth with your tongue. And then you take your tongue and you put it in the correct spot and you cluck. As you know, the correct spot, the spot is on the roof of your mouth behind the teeth and the bumpy ridges. The third exercise is correct tongue position with your swallow. Now, in order to swallow correctly, your teeth do come together and your tongue is supposed to roll from the front of your roof of your mouth to the back. For those of you, this might be difficult, so you need to practice it. You need to practice biting your teeth together and then thinking about swallowing with retracting your tongue. And this brochure will tell you exactly how to do it in detail. The fourth exercise is an exercise designed to help you get a little bit of retraction in your tongue. It's called elevation and retraction. And basically, there's 2 different ways to do it. One is to put your tongue on the roof of your mouth, open your jaw a little bit, and then resist trying to open your mouth further. And you'll feel some pressure inside your mouth in your tongue. The 5th exercise is elevation and retraction, and it's doing the same thing but in a little different spot. So what you do is you put your tongue on the roof of your mouth and you lean forward and you push your forehead into the palm of your hand and resist bending forward. Once again, all of these exercises are done with your tongue on the roof of your mouth. And once again, the brochure will tell you exactly. The 6th exercise is coordination of the tongue. This involves taking your tongue, placing it on the roof of your mouth, and making circles to the left and then circles to the right. This will be very tedious at first, but if you practice it for 5 minutes, several times a day, you'll find it gets easier. The 7th exercise may be very difficult for you because it's difficult for a tongue thruster to vibrate their tongue. But vibration is the 7th exercise. What you're to do is try to make a sound like a motorcycle. And once you get that, you just need to practice it a little bit. It just helps you with your ability to get the retraction and the placement and the habits that were causing you problems corrected. You'll find, if you're confused with this video, that this brochure that Dr. Ryder will give you will help you in all respects.